University School of Medicine. We did seek out to understand the relationship between structural racism and health because we know that ethnic and racial minorities have much worse health than others in the United States, including higher rates of chronic conditions, acute conditions, and earlier death rates. So what we did was study over 260,000 North Carolinians who lived in 150 neighborhoods in Durham County, North Carolina. And what we did was measure structural racism in their neighborhoods and measure their health. And we defined structural racism as factors which work together to create discriminatory conditions in neighborhoods that disadvantaged ethnic and racial minorities. We looked at 16 factors, which included the neighborhood racial composition, education and employment rates in a community, income and poverty rates in the community, criminal justice, housing, voter participation, and even the amount of green space and tree cover in the neighborhood. And what we found, in short, was that if there was more structural racism in a neighborhood, the health of the neighborhood was worse. So if you had higher structural racism, you and your neighbors were more likely to have higher rates of kidney disease, diabetes, and high blood pressure. These are three major conditions that we're fighting against in the United States and major conditions that we know that ethnic and racial minorities suffer worse outcomes from.
All right, guys. So on this edition of the liberal media trying to tell us why black people are too dumb to essentially control anything in regards to the outcomes that they have in life, we have to talk about this woke panel on MSNBC that is claiming that black people are not responsible for their own health. In fact, they're only about 20% responsible for their own health because structural racism is the most significant factor. Now, what I found to be so fascinating about this study and this conversation is that they decided to study Durham County, North Carolina. Now, I am very familiar with Durham, North Carolina. It is one of the most liberal counties in North Carolina. I spent a lot of time there in school when I went to UNC. So I found it fascinating how they wanted to use one of the most liberal counties in the state as an example of how bad black people have it in regards to racism, right? It's almost as if they're admitting that the presence of liberals or liberal policies doesn't actually really help with racism, right? Again, which is, a main reason why they tell black people to vote Democrat is that, they're going to fix racism. But again, you have one of the most liberal counties in North Carolina where apparently this structural racism is so bad that black people don't even have autonomy and control over their own health because the racism is so out of control. So I want to react to this ridiculous study because that's what it is. It's ridiculous. I mean, it's nonsense. And kind of go from there because, again, this is just comedy to me.
This study, it defines structural racism as the means by which societies perpetuate discrimination through interconnected systems, including housing, education, and unemployment. Can you clarify for our audience how the prevalence of certain factors like inadequate housing and schools and even the quality of nearby medical facilities, they are all indicators of structural racism, which can then negatively affect these actual health outcomes?
Yeah, thank you so much, Charles, for having me. An honor to be on with Dr. Boulware. Thank you for this study. It's so important to informing what policymakers need to do. I think so often we think about health as individual choices that patients make.
I mean, well, for the most part, it is an individual choice, right? A majority of your outcome in regard to health comes down to your individual choice and how you live your life, okay? Do you drink? Do you smoke? Do you have a healthy diet? Do you exercise? That is what a large majority of your health comes down to. Now, there are environmental factors that affect people's health. Like clearly and obviously, people need access to clean drinking water. They need healthy food, things of that nature, to make sure that, they're not toxic chemicals and stuff like that in the environment as well, too. Those things are important, right? But again, they play less of a factor than individual choices. You have some people who are genetically, predisposition to certain diseases and illnesses. They're unlucky, so that plays a factor as well, too. But for the most part, it does come down to your individual choice. Now, leftists will try to square their way around this fact by saying, well, poverty and education and access to resources all have an effect on the individual choices that you make. Well, it's still an individual choice. Just because you're poor, that doesn't mean that you have to eat unhealthy just because you're poor, right? Or just because you have, a low quality education, again, that doesn't mean that you can't exercise, okay? That, again, you have to eat unhealthy just because you have poor quality education, which, by the way, again, since they're studying a liberal county, there's something to be said about the education that's being provided by the Democrats and the liberals that are running this county. Again, if the inequality is so bad here, right? But they never want to talk about that. They never want to talk about that stuff. But regardless, there is no excuse, even if you're poor, in regards to not being able to eat healthy, because a lot of people, again, they get subsidies, they get food stamps. You can choose whether or not to buy vegetables and fruits and whole foods with that food stamp money, or you can choose to buy candies and sweets and sodas and all the junk that people typically buy when they are on food stamps, right? When they're on government assistance. That's an individual choice, right? That ain't racism. That's just the individual saying, I would much rather buy unhealthy foods than to buy healthy foods, right? Which contribute to their health, right? It contributes to them being obese and overweight, which causes other health problems. Which, by the way, an easy way to solve that problem, and I've suggested this, but no leftist will ever get on board with this, right? Despite the fact that they clearly believe that, black people aren't smart enough to make their own choices in regards to what they want to eat and, having a healthy diet. Okay, well, stop letting people buy junk with food stamps and government money, right? Stop letting them buy sodas and candies and, these very unhealthy foods. They should only really be able to buy whole foods, okay, and vegetables and fruits and healthy things. Severely limit what people can buy with food stamps, right? That would be an easy way to solve the problem, okay? Because then, even if you know nothing about nutrition and health, at the very least, in regards to the foods that you can buy, you're buying things that most likely means that you're going to intake less calories, okay? That you're not going to consume as many calories because you're eating healthy whole foods instead of these, sugar fortified snacks and, processed foods and things of that nature that are higher in calorie, which is contributing to the obesity crisis that we have in this country. But again, leftists would never get on board with that, right? It makes too much sense. Right? It makes too much sense.
Excuse me, that patients make. And instead, we really need to understand how practices and policies, the legacy of slavery, the legacy of Jim Crow, current day systemic racism impacts the health of our communities. So when we have people who have housing insecurity, who live in food deserts, who live in communities where there's not enough green space for them to walk around or to work out, where
all this is a lie, right? I can tell you right now, there ain't nowhere in North Carolina where there ain't enough green space, right? There's green space everywhere in North Carolina. There are no food deserts, right? There's Walmarts, there's grocery stores, there's access to food everywhere. I don't know what the hell these people be talking about, bro. I really don't. I grew up in a one-stop light country town in northeastern North Carolina, okay? We're talking about cotton fields and hog farms, nothing else, okay? Just a little small town, about 1,000 people, mostly black, okay? We had a doctor's office in the middle of the town, and you had a grocery store in the middle of town as well, too, okay? There was no such thing as a food desert. There was food right there, okay, in town. In fact, every small town had a doctor's office, and they had a grocery store, at least one grocery store. So again, I come from a place where I would imagine that if there's going to be a such thing as a food desert, there would be a food desert there, right? There was no food desert, okay? We had an abundance of food. There was a lot of green space everywhere, right? Now, again, I will say there wasn't a gym nearby, but again, that doesn't stop you from working out, okay? It doesn't stop you from being able to go to the gym because, in some nearby towns, there was like an actual gym, right? But still, I mean, this stuff that they talk about and they say all the time, I'm like, where is this? Where does it actually exist? I don't understand it. I don't get it, right? Maybe I'm ignorant, but I think they're making it up, right? I think they're making it up, okay? You know why I think they're making it up is because if food deserts were an actual thing, obesity would not be a problem in this country, right? It wouldn't be a problem in this country. In fact, according to this study right here from the annual review of resource economics that studied whether or not food deserts were myth or reality, it concluded there is little evidence that food deserts significantly contribute to diet quality disparities at the population level. A full-service supermarket sells both healthy and unhealthy foods because most residents of a food desert already shop outside of the food desert. Bringing a supermarket closer to the residents alone does not provide a significant enough incentive for consumers to increase the healthfulness of the grocery cart. So in a nutshell, right, this study just told us exactly what common sense would tell us, okay? When it comes to food deserts, there's no relation to that in the likelihood that you will be obese, okay? Because being in a food desert apparently doesn't affect your quality of food choices, right? Apparently, how far it takes to drive to the store doesn't really have much of an effect on what you buy at the store, right? Or the foods that you choose to consume or eat. Again, this is very common sense stuff. Okay, it really is. Doesn't take a study to figure this out, right? The problem with this country is that we have an over access to calories, right? We got access to too many calories. Okay, a lot of our foods that we eat processed are fortified with these extra calories that you don't see in these other countries, by the way. That's why you don't see obese people in other countries, right? If you ever traveled to one of these other countries right across the world, even in Europe, you don't even see that many obese people, right? The calories in their food is a lot less. Okay, in America, we have a problem with an over access or overabundance to calories. Okay, not the other way around. Okay, I'm just saying if food deserts was such a big problem, we wouldn't have an obesity issue. But the reason why we have an obesity issue because people got too much access to food in America, right? There's too many calories floating around. Okay, I'm just keeping it 100. Again, maybe I'm ignorant, but I just personally don't. I just don't know where they get this from. I don't understand it.
Not able to find gainful employment, where they're not able to have quality education. We know that racism is a key driver of what we call the social determinants of health. And what we see in terms of health inequities and health disparities are the downstream outcomes of those. And so I think it's so important for us to connect the dots. The dots that need to be connected are that, individuals are only responsible for about 20% of what makes them healthy.
Wow. You're only responsible for about 20% of what makes you healthy. 20%. So 80% of what makes you healthy in the United States. Okay. Let's be clear here. Okay. Because I believe maybe, just maybe, again, in other countries, I think that this would actually make sense, right? Where there's less access to food, less resources. People don't have cars. It actually, is harder to survive. People make a lot less money. I would believe this, right? I would say, okay, yeah, this makes sense, right? But in the United States of America, it doesn't make sense, right? So what they're trying to say is that, well, racism, structural racism accounts for your health outcomes more than your individual choices, right? In regards to what food you eat, whether you exercise, okay, your daily habits. In other words, the white man is God, right? The white man is all powerful, okay? He is a deity, right? That determines how long black people live, how healthy they are, et cetera, et cetera, et cetera. That's what it sounds like to me, okay? These people really do make the white man sound like he's all powerful, right? He determines everything, right? He is the great Alpha and Omega, right? This is what they make the white man sound like to me. Right? When they come out here and they say stuff like this, that racism is the most important and significant factor in regards to somebody's health. Wow. Incredible stuff.
The other 80% are these systemic factors that Dr. Boulware and her colleagues studied in this very, very important research that needs to inform how, communities and resources are given. So, for example, we have seen a chronic disinvestment in Black communities and communities of color, which have led to these poor health outcomes. So,
chronic disinvestment. Now, again, they studied Durham County, North Carolina, the most liberal county, or one of the most liberal counties in the state. So you telling me that this is what liberals do to black folks, right? Are you telling me, is this a result of liberal policies? That's what I really want to hear from them. Right. But of course, they're not going to address that.
So the results that, Dr. Boulware's study showed really needs to inform policies that impact health on a more holistic level. So it's not just about what medications a physician prescribes or a health professional prescribes. It's about what is the prescription for making a community healthier? What will allow it to have higher quality education, better job opportunities, more green space?
less liberal policies, right? Let's keep it 100, okay? Maybe if they had less liberal policies, that would all help contribute to these things, right? Like, school choice or less taxation or more business-friendly environment so that jobs can be created. I don't know, being tough on crime. I think these things would actually, help out more so than anything here, right? Just be less liberal. That to me sounds like the prescription that is needed here.
All of that is critically important. And I'm so glad that we are now discussing those factors instead of what happens inside of an exam room or a clinic room, because we know what happens at the community level has the highest and most significant impact on the health of our communities. And our communities deserve that because of discriminatory housing policies and other racist practices. We are seeing what we're seeing now in terms of these high burdens of chronic disease in our communities, diabetes, high blood pressure, chronic kidney disease. Essentially, it's killing us.
All these things she just named are a result of the individual lifestyle choices that you make, right? If you overeat, okay, and you eat a ton of fat and sugar, right, and an overabundance of calories, yes, you could develop heart disease, high blood pressure, right? If you drink too much, right, if you're an alcoholic, okay, you can develop kidney disease, okay? I mean, these are a result of your individual choice. That has nothing to do with racism, right? The racist white man didn't just snap his finger and say, hey, you got kidney disease, right? Or you have heart disease. No, that's not how it works. That individual made a choice to live their life the way they're living it, okay? And that's what contributed. Now, some of it is cultural, right? Like in the South, and this is not just something that applies just to black people, but particularly, it is especially true for black folks. Our diets are not good. Soul food is not good for us, okay? We put fat in literally everything that we eat, okay, including the vegetables, right? Collard greens, cabbages, hey, got the fat back meat in it. It's cultural. But at the same time, we live in a time period where you have a choice. That putting fat in everything is not good for you, right? People should be able to read a basic food label, okay, and determine, okay, is this something that I should be eating? Right? Is this good for me? But again, I would argue that this type of stuff should be taught in school. It should be taught in school. Now, again, if it's not being taught in school, particularly in a liberal county like a Durham County, again, whose fault is that? Okay, whose fault is that? Again, is that something for you that you're pushing for, right? For nutrition to be taught in schools, or are you pushing for critical race theory and woke gender ideology to be taught in schools? Because I would argue that, yeah, you're right. We should be teaching kids how to eat healthy and how to make better choices. But that's not something that liberals are pushing for. You're pushing to have liberals be taught about a bunch of things that aren't really going to help them out in life, that aren't going to help them gain skills or help them live longer or understand how to live a healthy life. Again, it's amazing. These people always want to come out here and boo-hoo, whine, and cry racism. But the irony here is that the places that they're claiming that this is happening are liberal counties, right? These are liberal places. These are places where their policies have achieved the outcomes, right? The negative outcomes that they're complaining about so much. Again, it's fascinating how that works. Let me know what you guys think. Make sure you like, comment, and subscribe. Most importantly, share a black conservative perspective. Peace.